Hello there everybody, welcome to Encompassing Finance. This is my second video on my channel. Just for a quick disclaimer out there, anything I do say in this video is not financial advice. It's just my own opinions and for entertainment purposes. So today I thought I'd do a screen share just to show you guys and girls my own research as well as some due diligence that I've done on Clearpoint Neuro stock. So I just thought I'd go off by starting it through their website. So Clearpoint Neuro basically it's a neurosurgery medical device company, which is kind of like advancing their medical devices as well as the biotech kind of aspect of things in terms of like drug delivery. So here's the website. It's quite basic, to be honest. There's not much that you can go off of their website. It's just a basic website about what they do and any kind of press releases they have. So it might be a good idea for you to have a look at investors tab on their website. If you just go into that link there highlighted and click on investors if this is a company you're researching or looking to learn more about. So what I'm going to do is I'm going to share my kind of like basic kind of understanding of the company. So how Clearpoint Neuro describes its business is the Clearpoint Neuro navigation system is currently utilized at 60 of the top neurosurgical centers in the United States. The system empowers MRI guidance for a range of procedures, including deep brain stimulation, so that's called DBS, laser catheters, drug delivery, and biopsies, allowing neurosurgeons to leverage live MRI imaging to decide, guide, and confirm procedures with sub-millimetric accuracy. So that's Clearpoint Neuro, basically giving our own description of why and what they do. So what's a competitive advantage? So it's the only company to deliver a drug by accurate catheter placement to the brain by using real-time MRI. There is no real-time MRI platform available on the market except for Clearpoint. Medtronic has the next brain platform that is used in a static way. So that's just like, it's not a competitor directly, but they use kind of like a different kind of procedure to kind of like deliver drugs and everything like that. But Clearpoint does it like through the whole MRI vision of things, whereas Medtronic does it through a static way. So they've got a lot of trials ongoing at the minute. One particular one which I'll talk about in just a minute or two. But anytime that any of those trials get approved by the FDA in the US, Clearpoint would be able to use their own lasers and medical equipment to deliver those drugs to the brain, heart, as well as the spine, because they're looking to do spine deliveries in the future now as well. So what I'm going to do is I'm going to bring up their 2021 February, so this is just last month, updated presentation on the investor relations page, just because the ones they had before were a bit outdated, so this one's the latest one. So that's Joe Burnett, he's the president and CEO, so I'm very quite fond of him based on how he's kind of changed the company. I think he came in 2017. That's when they started to change the name from MRI interventions to Clearpoint actually. So just gonna pick up some great slides on what the kind of opportunity is. So they say that there's two opportunities on one platform, so Clearpoint Neuro. Biologics and drug delivery with a broad portfolio of pharma partners indications with potentially explosive growth. So they're looking for that kind of growth in 2022. 2020 growth of 109% during COVID, so that's just saying something. I would say it is a reopening play. So the more obviously with COVID and everything going on, there hasn't been able to be as many trials and like surgeries in comparison to hospitals because everything's been so focused on COVID. And to be honest, the stock has run up. The stock's done. I don't know exactly how much it's gone up, but it's gone up around 200 to 250%. Even with the huge pullback that we had just a week or two ago. So it has gone up in 2020. I think this is based on the fact that a lot of institutions and retail investors like myself are getting into the company and knowing a lot about it. So yeah, it's just how they describe it: medical device company with an innovative and expanding portfolio. sort of a channel of on-site clinical channel. So yeah, that's just how they describe it. So most of these kind of like expectations and guidance that they're doing for these kind of presentations are for 2023 to just put that into perspective. So this is just something that they brought. I think they expanded um, like one of the offices into Solana Beach. Let's have a look. So this is just the MRI kind of thing, real-time image guidance for like surgeries and stuff like that, drug deliveries. That's gone on other machines. I do know they're bringing out a new laser. I'm not exactly sure when, but I do know they're bringing out a new laser. That's something Joe Burnett did mention in one of the conference calls. So these are just the smart frames, and this is something that they brought out recently. I think this is why they updated the investors presentation. So the Clearpoint Master Brain model license jointly developed with Philips. So they announced a joint kind of partnership with Philips, which is one of the largest neuro companies in the world, to be honest. So that's quite great. It's quite great, to be honest. So they're bringing out a model whereby um, they can kind of, it is kind of related to, if you want to say, Neuralink kind of uh, kind of related. So what they will be doing is, I'm not sure if they're not exactly in direct competition with Neuralink, but they will have some kind of, they could work alongside Neuralink, to be honest. They did do a partnership with BlackRock Micromanagement. So I'll talk about that just in a bit, but this is quite promising. I think this is coming out in 2023, the Maestro Brain model. So let's have a look here. So this is just a few of their partners is currently being used by. So Petrica Therapeutics, they've got a large basically stakeholder in Clearpoint. They own a large amount of shares. I think they've got a few warrants that they used to have as well. And this is the centers in the US, Canada, and EU. I think they want to get this up to 200 plus, expected by 2025. So around 60 plus at the minute. So it's almost double, if not more, to be honest. That's just probably a conservative level. So why Clearpoint would they say? Select and confirm the most accurate trajectory before inserting such live MRI guidance. Identify pre-procedural safety issues live instead of after the patient is closed. For instance, hemorrhage. Confirm proper target coverage with drug before closing the patient. So that's just an example of what they're doing. And here's the market opportunity. So AADC deficiency. This is something that I think is going to be approved possibly by the end of this year, if of the latest beginning of 2022. And in my opinion, once that does happen, we could get a double or tripling of the stock, just because that market in of itself is justifiable in terms of the current market price. I know that at the minute the current trading loss of the price, from what I can recollect, is around 20 or 25 of probably trading sales. Obviously, with all these trials going ahead, once they do get approved, I mean, there's so many trials going ahead. I think at the minute they've got 25 clinical trial partners, and they're looking to get 75 more. If you do, if there's research on that, to be honest, that's what the CEO has said. So if you listen to a conference call, he has said that. So just, but in of itself, just the AADC deficiency, once that gets approved, which it should do, um, the stock could drastically rise, at least double in my opinion. So that's just some of the stuff about how they go on from cannula network neurosurgeons. So let's have a look. So deep brain stimulation emphasis, that's the DBS. Obviously going to mention in regards to this a sleep DBS. This is something which I think when it gets a practice fully, I think that this could basically skyrocket Clearpoint. Clearpoint basically stock valuation. So going in a share, growing share, basically a growing market. So let's have a look. So obviously with Parkinson's disease, they get 6,000 or implants, 400 implants, so that's 7%, growing 10% basically. So the more, obviously when everything opens back up again, and for instance when a sleep DBS starts becoming more prominent, you could look at that Parkinson's disease and kind of like, I'm not exactly sure how much we can multiply it by, but if we multiply it even double, this kind of number right here is really conservative in my opinion. So let's have a look at any more of their stuff. So DBS, we just mentioned obviously that, early Parkinson's, multiple epilepsy. So there's all kinds of basically health issues, diseases, disorders that Clearpoint can basically help to address using their medical devices and as well as DBS. I do know they do it, like I said, I do know they're trying to bring out some kind of spinal kind of drug delivery system. I don't have exactly all the details right now, but I do know they're working on it. So this is the laser therapy, capturing the entire procedure. Like I mentioned earlier on, I do think they're bringing out a new laser. Exactly when, I don't have any information on that. Capturing the entire procedure, just some basics of some financial guidance, I guess. The total addressable market. Let's just sell on a beach, global scale, 4 players over 20. So yeah, they are saying obviously that they're looking to expand this. To be honest, when it's going to be widely known, it's probably 2023, 2025. Biologics and drug delivery, DPS navigation. This is the big thing for me, DPS navigation, especially if they can get sleep DPS correct and widely done. Because if anybody's having drug delivery done to their brain, for instance, you don't want to be asleep. You want to be awake while you're getting a laser drug delivered into your brain. To be honest, I think that's just everybody. I'm not obviously a patient, but that's just my own human kind of knowledge on that. So growth in case of volume and revenue. If you look at the revenues going, comparing last year's, especially to this year, it's grown quite a bit, even with COVID. So that's just showing how rapidly the company is growing now, especially under the new CEO, relatively new CEO, Joseph Burnett. So we'll be more look. I think that's about it in terms of the presentation they did. Because to be honest, there's not like much kind of like guidance in terms of like the presentation of itself. It's more like forecasts in terms of like what it could be. Obviously, because it's a small cap company, there is quite a lot of risk with it. So obviously I've got my own sources in regards to like getting information about it. But when trying to mention this, this is this is a doctor from Massachusetts in the U.S. So one of the reasons that he kind of said this, that kind of maybe getting to Clearpoint as well, is one of the reasons that the gene therapy field has been evolving slowly up to this point is that it's really not that simple to make sure that the vector goes where you want it to go. So that's basically drug delivery, everything needed to go where it needs to go without there being complications. So, but he said, so Dr. Richards says, but we've now established a gold standard. So it's referring to Clearpoint at this point for how one should deliver gene therapy to the human brain in instances where it's required to have the gene expressed in a certain location. So a pinpoint location. That's what the new laser as well. And obviously they got the laser already out now, but even the new laser should improve upon that. So in my opinion, that just goes to show. I believe this is a doctor from Massachusetts. I'm not sure which hospital it is, but Massachusetts in the US, and he's a neurosurgeon as well. You can just search up his name; it should come up. Um, so that just goes to show basically how neurosurgeons are even quite poised on this. So asleep DBS. This is the University of Utah. I'm in the UK, so I don't get all US terminology and like names and stuff right. So yeah, asleep deep brain stimulation placement in the intraoperative magnetic resonance imaging system hybrid operating suite. So asleep images guided deep brain stimulation offers greater patient comfort. So obviously that's what I mentioned earlier on. If I was a patient, placing electrodes in patients being treated for Parkinson's disease, offering this option may encourage patients to consider this underutilized treatment option. So this is what I kind of mentioned earlier on, that at the minute sleep DBS isn't widely used, but once it does, in my opinion, this is when we can get a huge kind of like trajectory up in Clearpoint, um, during stock particularly, as well as obviously the whole business fundamentals of the company. Let's have a look at a few more things. This is just off the Q4 call notes. which recently came out. So the CEO expects all 25 trial partners to resume dosing patients by basically the first half of 2021, which should help biologics deliver revenues, guiding for 190 to 200 procedures in Q1 2021, up 10-15% versus Q4 2020. Expect to expand into intra-article trials, AE spine, expanding addressable market. So that's kind of what I mentioned earlier on. Negotiating milestone payments with some preclinical trials. See gave example of basically potential phase 1 milestones, no mention of revenue potential from that. Partnered with BlackRock to develop products that allow them to expand into operating room and to do awake DBS. You said that will act as an insurance policy, so that they can do procedures for patients awake and asleep in the operating room or the MRI suite, expand addressable market basically. CEO said part of capital raise was to go after sleep DBS indication to market directly to patients that there are trials ongoing showing that getting DBS done early for patients, for Parkinson's patients beneficial. So yeah, what I mentioned is they're going quite heavily for that asleep aspect of things, and I think if they do manage to nail that, yeah, basically all the forecasts, all the guidance that they've put out, that'll be realized. If not, to be honest, a little blown away. So I'll just got one more thing to show you guys off of these kind of slides I brought here. So B Riley, which is to be honest one of the only analysts that look at Clearpoint, they raised the price target. This was I think it was about 2 months ago now, if not just under that, to $38 from 23. So obviously the timing of that wasn't great because they did the offering and then the price kind of plummeted with the whole market pullback. So 38 seems quite far stretched now, but eventually when the whole market kind of goes back to where it was, I'm not exactly sure when, but we could see that $38 price target being realized. So I just want to look at a few more things here. So obviously this is their Q4 results or reported fourth quarter revenue. So that was an increase of 16% compared with the fourth quarter of 2019. So that was the full year and fourth quarter highlights. You can see this all on the investor presentations website. So if you go on press releases there on the website I showed you earlier, if you want to just have a quick read through that, do your own due diligence. Like I said, I'm not giving financial advice, so it's good to do your own due diligence like I have been on the company. And just want to show you guys a few more things on it. So like I said, with Philips, this is something they announced to commercialize basically Clearpoint Maestro brain model. That was announced, I think that was on February 18th, so it's not even a month ago. That was an agreement and researching with Philips, and they also had one with BlackRock. Let me just find out what it was again. So yeah, BlackRock Microsystems multi-project joint development options agreement with BlackRock Microsystems. So like I said, this company is kind of similar to Neuro actually in what they kind of are looking to do. I'm not exactly sure if it's exactly the same as Neuralink, but with, in my opinion, Neuralink getting more and more prominent in the future, we can see Clearpoint as well becoming more and more prominent with neurosurgery. This whole brain kind of delivery of drugs to help diseases, even improve humans. That's what Elon Musk and Neuralink are trying to do, in my opinion. But yeah, let's have a look at a few more press releases of theirs, as well as something I want to share with you guys. So yeah, so they used the Clearpoint 2.0 system in Europe recently as well. I think that was only 2 months ago. Again, January, February, March. Yeah, 2 months ago. And they're trying to scale up in Europe as well, especially from Copenhagen, Denmark. I'm pretty sure they built an office in England as well. So where I am in the UK, I'm pretty sure that they opened an office recently. I'm not exactly sure what it is, but somewhere near London. And let's look. So they did the offering, like I mentioned earlier on. I think the offering was at $23.50. Yep, there it was. It was a large offering, to be honest, of their shares. Kind of already alluded to this by Joe Burnett, was that they did the offering to I wouldn't say market, but go for a sleep DBS, so a sleep deep brain stimulation. I'm not really sure if they need that much money, but uh, and if they did offering a price when the stock price had skyrocketed, so I don't really blame them for doing at that price. To be honest, $23.50, which is lower than what the price is right now. From when I last checked on Friday, the 12th of March, it closed around $20, so it's even less than the stock price right now is less than the offering price. So if you do want to get in, it might be a good idea to have a look now, especially with the market kind of being a choppy cycle at the minute and kind of, I wouldn't say it's recovering fully, but it's found a bottom last week. And lastly, I just want to share with you guys this post that they did last month. Is about, is it 3 4 weeks ago now? So Protector Therapeutics, Protector Therapeutics, one of the largest stakeholders in Clearpoint actually as well. They own a lot of shares. They've got a lot of options and warrants. Um, they kind of they're doing ADHD distribution trials. So they had patients under France's innovative early access program using Clearpoint, and that was basically done. So it kind of shows you that how far it is until we kind of get like some more information on ADDC, sorry, AADC deficiency kind of results. So as soon as that comes through, I do think the stock, I wouldn't say it's going to skyrocket, but I do think it could double at least, or even add like 50% to its current stock market value. But like I said, I thought I should share my screen to show you guys and girls, obviously, my own research and my due diligence that I've done on the company. There's a lot of information as well on Twitter about the company, because like I said, if you look at stock clicks as well, there's under 2,000 people that are watching the stock, and given that it's had like a 200% rise in the last 6 months, year, it's not a lot of people watching it. So imagine if there was 5,000 people watching on stock, it's a 10,000. So yeah, just do your own due diligence on the company. Like I said, it's not financial advice. I'm just giving my opinions and also sharing my kind of resources that I found on Clearpoint Neuro Inc. stock. Yeah, take care, guys. Subscribe to my channel. Hopefully, you got all the way to the end of the video. Peace.